What is the role of neostigmine in myasthenia gravis? Why neostigmine is used as a drug of choice in myasthenia gravis? For that, we should know what is myasthenia gravis. Myasthenia gravis, as the name suggests, myasthenia gravis means there is a severe muscle weakness. Now, this severe muscle weakness is because of marked depletion of nicotinic NM receptors at neuromuscular junction. There is a marked depletion of nicotinic NM receptors. There is decreased nicotinic NM receptors at the neuromuscular junction. And why there is a depletion of nicotinic NM receptors at neuromuscular junction? Due to formation of autoantibodies against NM receptors. Due to formation of autoantibodies against NM receptors, and that's why there is a marked depletion of nicotinic NM receptors at neuromuscular junction. Now, how this neostigmine helps in this myasthenia gravis? Neostigmine is having direct action on NM receptors. Direct action. This neostigmine is an anticholinesterase. Neostigmine is the anticholinesterase, means it inhibits that acetylcholinesterase enzyme. Neostigmine having direct action on NM receptors, and this neostigmine is the anticholinesterase. That means it inhibits acetylcholinesterase enzyme which metabolizes the acetylcholine. If we inhibit that enzyme, that means we'll get more and more acetylcholine. So there is an increased concentration of acetylcholine at neuromuscular junction. There is an increased concentration because we inhibit which enzyme? Acetylcholinesterase. So increased concentration of acetylcholine at neuromuscular junction. So now acetylcholine acts on NM receptors over a large area, and that's how we can use this neostigmine in myasthenia gravis, in which there is a severe muscle weakness. And here you can improve the situation by giving neostigmine, because there is increased concentration of acetylcholine now at neuromuscular junction. Now acetylcholine act on NM receptors over a large area, and there is an improvement in the severe muscle weakness or in myasthenia gravis.